Welcome to This Clinical Life, presented by Practicing Excellence. My name is Stephen Beeson, founder of Practicing Excellence. This Clinical Life dives into the incredible power of human development as a mechanism to help organizations, cultures, metrics change, an often untapped mechanism of change. And today I'm incredibly excited and honored to have with us our guest, Leon Morez from Innova. Welcome.
It's great to be here. Thanks for having me and excited to continue the conversation.
You bet. You bet. So, you wrote a book recently uh, called All Physicians Lead, and you basically articulate and push forward the hypothesis that all physicians are leaders, and that is a core competency as important as our clinical skills. What I would like to hear a little bit about is how you came to that thesis and a little bit about your leadership journey and how you got to where you are right now.
Well, I appreciate that. It won't take too long, but I'll scare you a little bit at my age saying that this goes back to fifth grade. So I know our time is limited, but it's a quick summary. We went to a small library in the small town that I grew up in, and we had to pick a book from the library, and then we were going to read it and do a short report on it. So being the obnoxious, competitive person that I was even then, look for the biggest, thickest hardcover book I could possibly see, and I pulled out The Making of a Surgeon by William Nolan. I read that book about his surgical training in Bellevue Hospital in New York and was hooked. I said, "That's it. I'm going to be a surgeon." So I'm growing up in Connecticut, got all the usual players as I'm in high school for pre-med, Yale, Wesleyan, Harvard, Hopkins. And a guidance counselor, Bob Gilligan, I'll never forget, said to me, "Hey, you're athletic captain of this, president of that. Why don't you think about going to West Point?" And I said, "West Point? I want to go to college. I don't want to join the Army." And here I was 2 hours away from the U.S. Military Academy, and I had no idea that it was a college. And he said, "No, dummy, it's a college. And I think you can go to medical school." So once again, it was serendipity. I visited, loved it. The culture, the camaraderie, the teamwork, the leadership training all seemed to gel in my head as the best place for me to be. But then I only kind of joke that it's sort of like joining a cult. You know, they shave your head and you run up and down the street singing, "I want to be an airborne ranger." And pretty soon you start thinking you actually do want to be an airborne ranger. So, in spite of getting accepted to my first choice medical school, I said, I think I'm going to be an infantryman. At the very least, if I was going to take care of soldiers for a career, I wanted to see what they did for a living. So I branched infantry out of West Point, went to the 82nd Airborne Division. So now I've gone from, high school and some volunteer elected leadership positions to 4 years of leadership training at West Point to a tour in the 82nd Airborne Division, ongoing leadership training and development. I get to medical school and I noticed there was no formal leadership training in the curriculum. And I thought, well, doctors are technicians. They're not really leaders. I get it. We're cognitive folks, we're technical folks. But through that lens, when I started practicing medicine, I recognized that if you take a fundamental definition of leadership that is influencing behavior to achieve a desired result, then every doctor every day is doing that multiple times, whether it's trying to convince a patient to stop smoking, lose weight, take their medicine. That's a leadership event. Trying to work with your staff to get through a busy clinic is a leadership event. Running a code in the ICU or the trauma bay, doing a case in the OR, you're leading all the time. And I recognize that not only do we not teach and train doctors how to be better leaders from medical school forward, but we're not even explicit with doctors that they are leading. And this is one of the things I want to remedy, get that message out with the book and with opportunities like talking to you today, Steve. Thank you.
The idea of how do we create the capability of organizations to change? I think one of the most important things and one of the most important influences is how the organization is being led locally. And, the clinician as local clinical microsystem team leader is
Yeah.
such a powerful concept to create the ability to change. But physicians don't often see themselves as leaders. And what would you say to organizational leaders or physicians themselves in terms of making the case that the physicians are team leaders? Because we see
It's
ourselves,
interesting.
yeah, we see ourselves as, assess a symptom and issue a treatment plan and advance wellness, right? I mean, that's what we went to medical school for. How do we pivot that conversation?
That's right. No, and in fact, when you go one step further, there are actually some headwinds to advancing that conversation, not the least of which is that when I was going through my training, we kind of looked skeptically at, quote, physician leaders, someone who had gone over to become an executive. Maybe they weren't really a good doctor. That's why they're doing this, executive position. They're not really in the trenches, taking care of patients, being a, doggone it, clinical surgeon, clinical physician. I'm a real doctor, not a doctor down in carpet land running budgets and strategies. If you ask 100 physicians to name a physician leader, they will inevitably name a chief, a chair, a medical director, maybe a chief medical officer or a CEO. They won't say, I am every day. I'm leading dozens or hundreds of times a day. I'm influencing behavior because of my role as a physician, the position in the medical hierarchy. And I'm not saying that doctors are all that or doctors are the boss, but the credentials, the privileging, the decision making, we call them doctor's orders, not doctor's suggestions for a reason. You are leading healthcare teams and you are leading patients and families to engage in a treatment plan. And the degree to which you are culturally competent, you demonstrate caring, you communicate well, that patient and family and that healthcare team is going to perform better. And there's very good data that shows that.
As we look at the influence of leadership attributes of a CEO versus the local physician leader, talk to us a little bit about the impact of the local leader and the kind of dividends that arise from effective local physician leadership. What good things can happen as a result of physicians leading effectively in their clinical microsystem setting?
Perfect question. And interestingly, we pour a great deal of energy, time, and resources into physicians who are mid to late career, who are now becoming a chief or a chair or even a chief medical officer, and say, okay, now you need to learn how to lead. When, as we've already talked about, those physicians in the front lines are leading all the time. In fact, if you Google physician leadership, you'll end up with 1.2 million hits in zero point 0.8 seconds. If you go on Amazon
Right.
and look up physician leadership, there are dozens of books, there are courses everywhere, and they are uniformly, except for All Physicians Lead, uniformly targeted toward those doctors who are now becoming a medical director, a chief, a chair, and say, oh, now I
Right.
need to learn how to lead.
Right.
And the reason that's so paradoxical is that if you do empirical literature searches to try to determine CEO characteristics, CEO traits that impact organizational outcomes, it is virtually impossible to come up with an empirical data-driven proof that any CEO traits at all impact organizational outcomes because there's too much stuff, too much time lag, too many variables
Too
in
many
between
layers.
those
Right.
two to
Yeah.
give a statistically significant answer. On the other hand, there's a ton of data out there that shows that frontline leaders, frontline managers, managers that are close to the point of production across industries have a measurable and valid impact on productivity, on retention, on environment, in our case, environment of care, error rates. So that influences the patient experience. And ultimately, there isn't any good data out there yet that shows that it's going to affect health outcomes. Because again, there's a lot of variables in between
Right.
how an office performs or how an OR performs and the outcome of an individual patient. But if you've got better retention, a more engaged team, fewer error rates, better environment of care, linking that to patient outcomes is not a difficult leap.
It's so interesting. Not only do I fully concur based upon 25 years of observing highly effective local physician leaders and what they do for the dynamic and the culture and the performance of their team, but I would also contend, and I would be able to ask you, what does it do for the clinician? Meaning,
Ah,
I've learned a set of skills to allow me to lead my team effectively. What happens to the clinician who is an effective team leader and what that does to their experience? Talk about that literature and your observations in terms of what it does to the physician themselves.
yeah, leadership doesn't stop when you leave the office. So the traits and the characteristics as a leader, as a human, that you bring to effective leadership at work are going to spill over to your home life, your friends. When you're sitting at the ball game, the internal self-awareness, in the book we call it leading self. That is the fundamental underpinning of being a good leader is knowing what your tendencies are, what your traits are, constant improvement with the intent to improve, reflection on both good and challenging, if you will, leadership events, day to day, week to week. And we all have them, right? We all have these uncomfortable interactions. And a good example would be, you know, you you're driving into clinic, you might be a few minutes late. You get to the gate by the parking garage and your badge isn't working, right? So the gate doesn't open. You have to go around, park in surface parking. It's raining. Now you're even more late. You walk into clinic and the clinic administrator's right there and says, "Hey, Dr. Moores, how you doing?" And you just let him have it, right? I've done it. I hope I don't do it very often anymore, but when that happens, you have a couple of options. If you don't think of yourself as a leader, if you don't think, hey, my actions have influence, my behavior has impact, then you probably just walk away going, that jerk, he has no idea what I'm going through. If at least you think, I'm a leader, that didn't go well. Why? What set me up for that failure moment? How can I do better? Reflect with the intent to improve. That's sort of level one. Level two is you realize, oh my gosh, I need to work with that administrator. So I should probably go back and make amends, say, hey, I apologize. This is what was going through. Won't happen again. I'm going to try to do better. Level three is you recognize that other people in your clinic saw that. So what does that do to the psychological safety of that environment when they know Moore's is in a bad mood today? Are they going to be willing to bring you news that there's a patient that's late? Can you still see them? Hey, here's a red flag we need to point out, maybe a patient complaint we need to deal with. They may completely back off. So level three is you go to your team and say, look, I'm sorry I lost it there. And those kind of behaviors, that kind of introspection, that kind of self-awareness of your impact really makes you feel better at the end of the day that you didn't just let that sit and, eat
Yeah.
away at your soul.
The other things that I've seen in physicians leading the teams effectively, because I've had a chance to be a top-down micromanager of my team, where if you want it done right, you do it yourself. That was
Yes,
my
yes, yes.
when I finished residency. That was
It's kind
me.
of how we trained, right?
Right. It was,
Yeah.
it's the Lone Ranger medical training, and over time, learn the power of tapping people for their ideas, the power of recognizing and appreciating people for who they are and the work that they accomplish, the idea of giving safety cues for people to feel safe to raise their hand for new
Yeah.
ideas or pending harm. All of those come from the cues of, or can potentially come from the cues of physicians as local team leaders leading effectively. My question is, does the application of leadership development to all physicians as a core competency help advance those skills? And what experience and literature do you have that leadership development can help manifest effective physicians as local team leaders?
I'm very agnostic about what people read or what courses they take to become better leaders, first of all. But as some examples, I love Goldman's work on leadership styles. And if you take an individual physician, and we'll pick a neurosurgeon, I'll beat up on neurosurgeons because I can, right?
Right.
And the stereotype of neurosurgeons, which is probably there for a reason, is that they're, demanding, that they're, you know, not always easy to get along with, maybe prickly is a not a bad term. And some of that's because, you're under pressure, you're dealing with highly complex disease processes and procedures. And so demanding perfection may not be a bad thing. I mean, you probably want your neurosurgeon to be a little obsessive compulsive, right? If you don't see yourself as a leader and you just bounce around your day without reflecting on a leadership style, then when I'm in the OR, last week at midnight with a kid that was hit by a car and, the child's dying in the operating room and there's 15 people in there and blood is being poured in and, we're almost starting chest compressions. That is the time to be commanding, pace setting leader, right? So if you recognize that and say, we need to move and directive guiding. However, if that's my default mode and I don't realize it, and I go to clinic the next day and I'm in demanding pace setting mode, or even more extreme, I go to an executive council meeting for my healthcare system and I stay in commanding pace setting mode, that's not going to be very effective. So, what learning about leadership does is it opens your eyes to these styles and it tells you that there are different styles out there. I may be more affiliative in clinic and more democratic in the board meeting, but knowing that they're there, recognizing when one might be better than another, and then being able to apply them requires some fundamental underpinning in the theory and practice of leadership of humans. And so, one small example, but there's a breadth of leadership out there. And for folks to explore that, become self-aware, realize what their impact is, and work to make that better would have tremendous impact. And, the data that we talked about earlier that shows that using various descriptions and rating scales of what a quote good leader is, that good leadership really impacts the team's performance.
How do we begin to shift the identity of physicians? And I know that you've been an advocate for this for with your book and your life and as a leader yourself to begin to shift the identity to all physicians lead. What would you suggest to organizational leaders and physician formal leaders, and where we can begin to shift the identity to begin to see physicians as team leaders? What would you suggest as an intervention, if you will, to advance that shift in identity from diagnostician, technician to leader?
Yeah, this is a generational effort. And I'll give you an example from my time in the infantry in the 82nd Airborne Division as a platoon leader, as an infantry leader. Then you have an expectation that when you go out into the field, yes, your performance is going to be evaluated based on, did you achieve the mission? Did you effectively go across country, find the objective, deploy your forces properly, all of these technical and cognitive aspects of doing that. So that's akin to, did you make the right diagnosis? Did you do the right procedure? Did you do the procedure well? Additionally, though, you would constantly get feedback on how you led that team in a stressful environment. Combat simulations are designed to be stressful. How did you hold up? What could you have done better? that's a cultural expectation in that environment. To get there, though, I think we need to dial it all the way back to medical students and residents, build it into the training. A, be explicit about the fact that you are going to lead. It's not a question of whether or not you're leading. Based on that definition, you are. The question is, do you recognize it? Do you recognize the importance of it? And are you trying to get better? And I think the ultimate link to that, as the subtitle of the book suggests, is this will lead to better patient outcomes, better patient health. That's why we all go into medicine. So, yes, I can make the right diagnosis and give a recommendation, but if my team in the clinic is dysfunctional and the patient and family sense that, and I'm not leading well in that particular encounter for whatever reason, then
Right.
they may just walk out shaking their heads going, this place is a disaster. I don't believe them. I don't trust them. And then ultimately what happens after a generation or two of students and residents comes through, then you're going to have mid and senior physicians who recognize the importance of not just saying to a resident, hey, those are really good knots you tied, junior resident. That suture line is absolutely beautiful. That's exactly what we need. But also will say, and when the scrub tech dropped the instrument that you were using, you did great. You just smoothly said, oh, that's okay. I can use one of these. Potentially a stressful situation. You handled it well. You were self-aware. You treated the now embarrassed scrub tech with respect as a fellow human. Nice job. Really good leadership you just demonstrated there. That's what I think we should get to.
And it's almost a declaration. I love the declaration of all physicians lead. And then the idea of how do we toggle back a leadership development pathway to allow clinicians to advance things like compassion, authority gradient reduction, self-awareness, emotional intelligence, gratitude, continuous improvement, psychological safety, all those things that make for these amazing teams. Those are all accessible through a human development strategy.
Indeed.
Develop those things. And have you seen, my question is, have you seen any organization develop all clinicians as leaders, as opposed to the cohort of 15 or 20 emerging leaders or formal leaders? Have you seen any broader, wider aperture development efforts in your work in this all physicians lead commitment? Have you seen any organizations actually do that, develop all their physicians to lead their teams?
Yeah, much to my enjoyment, my alma mater, the Uniformed Services University, which is the military
Right.
healthcare university in Bethesda, Maryland, now puts every single medical student from year one through a 4-year graduated, progressive, cohesive program of leadership development. Residency programs haven't bought off on that, so then they kind of go off into the wild and they're self-taught again. I'm not aware of, and if any of you out there are doing this, please contact me, leon.morris@allphysicianslead.com, and share that because I would love to see the template and the model that you're using to get all physicians on board with some even self-guided leadership program. Tell them, hey, you're leading, here are some tools to make you better, and would, really, really love to see that going forward. As I mentioned before, I think it starts in medical school, and we're reaching out to medical school deans and deans of students and associate deans for curriculum, et cetera, et cetera. The neat thing about it when you look at most medical school curricula is there are a lot of touch points, a lot of contact hours that I refer to as leadership adjacent. So you might have human contacts and professionalism and communication skills and many other hours, tens,
Right.
dozens of contact hours, but they're not put together in a programmatic, cohesive, coherent, progressive fashion that says we're going to assume everyone's a novice, and we're going to teach them fundamental leadership skills using these contact hours already in the curriculum so that when they graduate, we know they've gotten to a certain level that we prescribe, just like you would with procedural skills, cognitive evaluations. The good news is that medical schools and residencies know how to build curriculum. They know how to teach adult learners. They know how to assess adult learners. This
Right.
is just changing the content a bit
Right.
to focus on the specifics of leadership skills. The other advantage, I think, is that I remember as a student, if I had a choice of spending 3 hours on a soft skill, if you will, and I don't like that term, and I bet you don't either, um, paper versus spending 3 more hours studying neuroanatomy, my time's going to neuroanatomy, and I'll do whatever I can for this other thing because we really didn't link all of those to this is going to make you a better doctor. This is going to be better for your patients.
Right. It's so incredible as I reflect on my personal life and in my work in developing clinicians to contribute to better care. All those soft skills that you articulate, which is our ability to communicate with our team, our ability to leverage influence to mobilize people around a shared purpose, our ability to give belief in our team members that they're able to contribute to the well-being and the health of the patients that they take care of, and to be able to do those actions to build the teams that are really culturally rich and providing amazing care is such an unbelievable experience, as I mentioned before, for us as clinicians. And I
Yeah.
think the biggest challenge, and the reason this book resonates so deeply with me is there's such compelling literature that when physicians lead their teams locally effectively, their teams will soar, and the people in them and the patients that they take care of will get better care.
Yeah.
Uh, but the big missing link that I see is just the formulation of an identity, the declaration of physicians as team leaders as the identity of physicians. It's still not the pervasive way that we see physicians in, system-based levels of care, is that physicians or local team leaders are still it's we're still seen as the treadmill driver of seeing one patient at a time
Yeah.
as opposed to the local team leader. And trying to shift that identity, I think, is going to be a critical part of the lever of building physicians as team leaders.
Yeah, and I think appropriately so for at least since I was in medical school, we've really emphasized to students and residents that medicine is a team sport. It's too complicated to do by yourself. You're not an island, black bag on your horse out to somebody's house. That's never coming back. And so to some degree, we've beat the drum of this is a team and you're not all that. And again, I want to emphasize we're not all that. We're not special people, but there's a decision maker. And so I liken it to either being an infantry platoon leader or being a quarterback of an NFL team. You can't do it by yourself, but somebody ultimately makes the decision. Somebody's, attitude, I mentioned earlier, if Moore's is having a bad day, kind of everyone's having a bad day.
Yeah.
And that influence, that impact is what I mean by leader, not boss. It doesn't mean you're smarter, better. You may be a brand new intern on the ward or a junior attending in a clinic where you have, nurses and technicians and administrative professionals who've been there 10, 15, 20 years that know this playbook inside and out, but ultimately you're the decider.
Yeah.
And the degree to which you are able to, we haven't even talked about listening skills. You mentioned psychological safety, people's willingness to come to you and say, hey, I think this might be a better way to do this. How do you build that? These are all fundamental leadership skills that, we don't talk much about. And again, we don't
Right.
teach in a coherent fashion to our junior doctors to prepare them
Yeah.
to be effective leaders in the trenches, like we talked about.
One of the things that I've seen tremendous of is variance
Yeah.
of how physicians show up as a team leader.
Yeah.
And again, when you don't have a programmatic development, list of attributes and actions that influence thoughts and behaviors of people to drive an outcome, your definition of leadership, then we have this wild variance
Yeah.
of and the impact of that variance on team performance, culture, retention, and all the things that we care so much about. Talk a little bit about the impact of ineffective local physician leadership and what that can do to a team performance, patient outcomes. Talk a little bit about that as a flip side.
Sure. One of the greatest examples of that is, Skinner and future investigators who had the rats in the box, and if they did something bad, they got shocked. If they did something, they got a food pellet. But, and I'll have to look up. It's been a long time since I looked it up. The future investigator who coined the phrase learned helplessness, so that no matter what the rat did, it couldn't tell whether it was going to get a shock or a food pellet, and they would just lay in the box helplessly. And that behavior, in the worst case scenario, where you have a leader who is unpredictable, wants one thing one way one day, the exact opposite the next day, is happy one day, is tearing people's heads off the next day, leads to that learned helplessness, decreased engagement, high turnover, increased error rates that is very well documented.
Yeah,
Those are the kind of things we clearly do not want in any environment, particularly the high stakes environment of healthcare
right.
where we work. And when you talked about variation, and obviously one of the things that we strive hard to do in healthcare is to avoid unwarranted variation. Well, people are human, so there's always going to be a bell curve without any exposure to A, the fact that you're leading, and you should at least reflect on it with the intent to improve, and B, some of the fundamental theory and practice. That bell curve is really wide. So two things will happen if we start to homogenize, if you will, the education around leadership development for physicians is A, we narrow that bell curve, two standard deviations becomes not quite as far out, and B, we shift it to the right.
Right.
So the mean moves
Yeah.
when we give people these tools.
It was interesting, speaking of the impact of behaviors, and the impact of a single person showing up a certain way, and that variance, sometimes just the inconsistency. There was a book that I love by Daniel Coyle called The Culture Code, and in that they reference studies that one downer that becomes a part of a group of 8 to 10 can diminish the energy and ambition and discretionary effort by about 40%.
Wow.
And if you look at clinicians who show up, and again, 50% of us are experiencing burnout, right? Cynicism, depersonalization, exhaustion, and we signal that as the local team leader, you can see what's going to happen to the team that is looking for the cues from their leader.
Yeah.
And the idea of, tightening that curve, creating consistency and moving the curve to the right in terms of leadership skills and attributes are certainly going to benefit the team. But as I've said, and I know that you know better than I, is that it's profoundly beneficial to the clinician to show up in a way that allows their team to really engage, mobilize, work well together, and really take care of each other as a team, providing care to patients together.
Yeah,
Um,
to that stress that you talked about and overworked, overregulated, EMR to tears, right?
right.
There are several ways you can show up as a physician leader in that environment. One is, you're kicking trash cans and you're like, this doggone EMR doesn't work, and get IT down here right now. Everybody sort of feels that emanating from you, and as you said, sort of brings everybody down.
Yeah.
The other extreme, which is also not appropriate, is to be false and be a cheerleader making false statements about how great everything is. And that is seen fairly transparently as, your BS, doc. We know that's not true.
Right.
But some happy medium that says, hey, we all know this is a challenge, but we're going to get through it. And this is how we're going to do it together. And here are some workarounds, if you will, or I'm here to support you. We're
Right.
all here to support the patients, is that sweet spot for leading in that uncomfortable environment that, yes, we're all in, but we are all in it together. And you know what? We really do great work. And
Yeah.
focusing on that and telling folks that, we had 40 patients today that came in and out of this clinic that are better off for being here.
Yeah. And as you mentioned, I think it's, physicians leading with growth mindset as an example,
Yeah.
bringing hope, belief, optimism, grit, feedback rich, and saying to the team, I know this is brutal right now, but I believe in us, our mission, and
Yeah.
each and every one of you. Let's go. Let's get after it.
Be honest.
That's
And
that signal from a clinician can change everything as
yeah,
opposed
for
to,
sure.
oh, yeah, as opposed to we're screwed. I can't believe administration did this. Is EHR,
Yeah.
whatever, kind of that backseat victim thinking. Those are all leadership cues and potentially leadership behaviors that allow us to leverage our influence to mobilize people to execute outcomes.
Yeah. And currently we're in the see one, do one, teach one mode of,
Right,
of what I call accidental leadership development, right? Your
right,
chief
right.
resident yelled and kicked cans, your chairman yelled and kicked cans. So you think, all right, well, it must be how everybody does it. The other challenge that we have is historically less than optimal behavior, shall I diplomatically say, by physicians has been tolerated. Now we're better. And if you're three standard deviations outside the mean, then you get your hand slapped and you do it a couple times and you get fired. But that's the rare example. Most of the time, people tolerate you being less than optimal as a doc.
Right.
And unless other docs are helping each other, and unless, we start very early saying, you are going to feel this way. You are going to feel stressed. You are going to feel overwhelmed. You've got people's lives and health in your hands. You're making decisions. That is inherently stressful, even if you take all these other things away. Here are some tools to help you manage that stress. And here's the effect on the team's performance, and ultimately your patients if you're unable to do it well and constantly improve upon it. So that's the overall message
Yeah.
is you can do better. And one of my favorite examples of that is, for those of us who lived through and others who've seen the Apollo 13 movie, the ship is traveling in space and it starts blowing up. So almost certain death, there are chunks of the ship coming off and venting into space, right? And the commander, who's responsible for the mission and the other astronauts, and that's a huge responsibility, picks up the microphone and says, Houston, we have a problem. That's it, right? Cool as a cucumber, in control. Let's fix this. There's no, yelling and screaming and, pounding on the glass and we're all gonna die. This is
Right. Right.
terrible. Can you believe NASA sent us up in this piece of junk?
It,
Right?
so that's such a great analogy. And we spoke, we really began the conversation around what are the leadership skills that make us effective to lead our team well. And you spoke about, self-awareness and knowing what our triggers are. So if we know that when we begin to run behind, we get agitated,
Yeah.
begin to yell at our team, and get really irritable and difficult to be around, you know, I ran behind on most days, and I realized that was a trigger for me, and I had to respond to that circumstance different. And
Yeah.
self-awareness is about learning what my triggers are and modulating my response. So the cues that I sent to my team were different, and it fundamentally shifted how the
Yeah.
team operated. And people going home at the end of the day saying, that was horrible. I hate working with Dr. Beeson. He's always so irritable and yelling at me too. Man, that
Right.
was a brutal day. We got through it. We got behind, but man, we helped each other. We got the flow down, and we got through it.
Everybody high fives at the
Yeah,
end and
yeah,
says, I mean,
yeah,
shared difficult experiences are incredibly team building.
yeah,
It
yeah.
is the blueprint of military training for thousands of years. is you put a bunch of yahoos in a meat grinder, you see who comes out the other side, and they're bonded for life.
Yeah. Yeah.
So, great example of that in our business was COVID.
Right. Right.
You had folks that, right, were coming to work not knowing if they were going to get sick. And I contrast that with the military experience. Military has life and death opportunities as well, but you signed up for that and you knew it going in. Most of us in healthcare, the plague was so long ago that we don't think that I'm really at risk. I mean, if you get a
Yeah.
needle stick or, you
Mhm.
happen to get TB, but those are really rare. Those are outliers. In
Right.
COVID, all of a sudden, everybody thought, boy, I go to work, I could die. And level two on that is most folks in the military, if they deploy and, God forbid, get injured or killed, their family's not going to die.
Right.
Early on, you get COVID,
Who
most
knows?
of us had colleagues that were living in their basement with no contact with their families
Yeah.
because their families were at risk too,
Right.
and think about the strength that that took for, providers, technicians, administrators, all of our healthcare colleagues to keep coming to work, taking care of some of the sickest patients we'll ever see.
Oh my gosh. Well, I know that we're approaching our the end of our podcast here, but there's a couple of things that I just want to say. One is I would recommend everybody read All Physicians Lead. It is such an important practice of advancing American healthcare quality, culture, and performance, not only for the patients and the communities that we serve, but also for healthcare teams. When they are effectively led, everything can change in terms of what the clinical life is like for
Yeah,
the
thank you.
physician and the team that they're a part of. So thank you for that. I have referenced it in every talk that I've given as a critical reading list. And there's 3 or 4 books that I recommend in that as
And I
well.
have not paid him for that, just to be clear,
Right.
everybody. No, this
No,
is
no, no,
totally volunteer.
and the second is I want to do whatever I can in the company that I founded at Practicing Excellence to leverage our capacity to do human development at scale to advance the capabilities and competencies and the leadership abilities of physicians everywhere. And I would love to be able to do that with you, Leon.
That'd be awesome. I would
Yeah.
really, really appreciate being able to partner. I've, had
Yeah.
you on my radar and been recommending your books for years. Great messages, great results that you've
Yeah.
shown. And I think they interleave very, very powerfully. So I appreciate that and happy to partner.
Yeah, no, I think that'll be a fantastic opportunity to build a program called All Physicians Lead and to even certify physicians on the basic fundamentals of leadership of the local clinical microsystem.
Nice.
So yeah, it'd be amazing to have you as faculty for that. So anyway,
Sign me up.
yeah.
Done.
So
Yeah, that's an easy yes.
anyway, so in summary, I think that the declaration of the identity of physicians as leaders, the idea of continuous systemic development of leadership skills, and what those leadership skills are pretty well known, and how it is that we do it
Yeah.
is less important than we dedicate ourselves to helping and supporting clinicians to lead the teams effectively. Again, I'm so appreciative of the work that you've done, and the advocacy for physicians as local team leaders is so important. And again, the story that you tell and the leadership skills and how you got there and the impact that it can create has been really inspiring for me to see and be a part of, in terms of a student of yours, if you will. Um,
I appreciate that very much and looking forward to continued partnerships.
Yeah. So any final words of wisdom for those out there in terms of this notion of all physicians lead? Any final words of wisdom that you want to lead with?
Yeah, one of the things that I like to tell folks when I give these talks, and if there's, 30, 40, 100 people in the room, is that if only 3 people walk out of there saying, hey, I get this message. I recognize that I'm a leader. I recognize that I have impact and influence and I want to get better. Even if your system isn't teaching you, even if your medical school and residency didn't teach you the fundamentals of leadership, there's a ton of information out there. Start slow, reflect with the intent to improve. You will make a difference if you just work on your self-awareness, your ability to lead others, and it will make a difference for your teams and your patients. So don't wait until your healthcare system builds a program. The other nice thing about that is we don't have to reinvent the leadership wheel for medicine. Everything that's out there across industries, the practitioner literature, the empiric literature, all applies no matter what you're doing professionally. So reach out, grab some things, uh, reach out to All Physicians Lead, check out our website at allphysicianslead.com. There's a ton of information there, podcasts, newsletters, blogs on fundamental leadership information, and dig in.
Right. Beautifully said, and such an important body of work in terms of how do we make American healthcare better for patients, for communities, and those that are providing care. All physicians lead. Leon, thank you so much for joining us on This Clinical Life.
Thank you, Stephen. Thanks for all you're doing to move that needle as well.
You bet. Okay, we are out.